Hi, folks. Rick Silver here. Forgive my COVID haircut and my COVID t-shirt and even my COVID headphones as I try to improve the quality of this piece I'm going to read to you that I'd written. Read it in a Zoom meeting. Uh, Things are still pretty much affected by COVID these days. And one of the things that I think a lot about is how is it that we need to hold one another emotionally and spiritually as we go through this very long journey with lots of unknowns and lots of loss that we haven't even fully experienced yet. I was working with one of my patients the other day and sort of doing my usual therapist slash psychiatrist thing, trying to be, supportive and helpful and paint a positive picture. And it became very clear very quickly to me that she did not want to hear about that from me. She's somebody who's a survivor of trauma, and her identity was as somebody who'd been living in a lot of pain for a long time. And for me to come in with a very positive attitude and say, hey, let's try these meds, it'll make you feel better. Do this kind of therapy, it'll make you feel better. That really in some ways was a invalidation of how she experienced her life. And I spent some time talking to my colleagues afterwards and thinking about it. And I realized that a lesson that I'd learned before, needed to hear again, was that all we can really do is be present with the person as they are experiencing their own pain and their own journey. And that we can't really try and impose our need to feel better and reduce our own anxiety on them in a moment. And this holding of a person in suffering can be very difficult to do and can last a very long time. So I'm grateful to the patient for having offered me that lesson in the work that we did together. And I wrote this piece that I'm going to read you from that. It's called Wrestling with Angels. Redemption and release in the face of pain is a psychological and spiritual theme from time immemorial. In this time of COVID, we are reminded that hope is what gets us through the darkest of nights, without which we are overcome with a sense of desperation and fear. Most of us understand intuitively that light will follow darkness, and it is precisely this appreciation of something better to come that allows us to endure. But not all of us are blessed in this way. Some souls who have encountered early and repeated wounding in their lives may find it difficult to muster positivity in the face of life's challenges. Their lives instead torn by an unrelenting emotional turmoil. How are we to understand our role as caretakers of one another's souls when we encounter this level of suffering? The question becomes all the more relevant when so many of us are now burdened with the trauma that accompanies this devastating pandemic. In Genesis, we are told the story of Jacob, who is alone in the desert, his father-in-law in pursuit, his wives, children, and flocks sent across the river as a bid to placate his brother who has threatened to kill him. At that moment, when he believed that nothing more could be lost, God challenged him to do a night-long battle with an angel. As the wrestling match drags on until daybreak, the angel realizes that he will not prevail against Jacob. So he blesses him with the name Israel, which can be translated as one that struggled with the divine angel. As Jacob says, I have seen God face to face, and yet my life has been delivered. As humans, we are fated to wrestle with angels. Life is difficult, and bit by bit, we gain some measure of enlightenment as we grapple with and make sense of the painful trials that are an inherent part of every life. What we are given to understand in the story of Jacob is that God means for us not to live forever in pain, but instead to have the opportunity for redemption, for recovery, for deliverance. To the degree that we take our inner wrestling matches seriously, we will be blessed with a deeper appreciation of the spiritual as it pervades every aspect of life. While many of us have, during a crisis, found our identities temporarily absorbed within and powerfully shaped by a particular struggle, we usually retain an anchored sense of self, a fundamental home within that allows us to hold on to hope for a sense of resolution and easing of our burdens that will once again allow us to experience our lives in a more full and settled way. As we age, we come to realize that life is but an endless cycle of struggle and release, of death and rebirth. If our souls and psyches are healthy, we have faith that comfort will follow trauma, that hope will follow despair, and that each cycle of the wheel will offer the gift of a deepened and enriched character. At the root of this cycle, at the root of our ability to look beyond the moment of pain to some future ease, is an embodied emotional experience that many of us know from a time before words, a time when caregivers or parents held us tenderly and softly, stroked us and gazed into our eyes, fed us and nurtured us. In these moments of early infancy, as the bond between parent and child was formed and fortified, as we were given succor for our troubles, our parents taught us how to hold hope in the midst of anguish. Having wrestled repeatedly with their angels, they showed us through loving touch and gentle words that God can offer solace at the end of a long, dark night. But many among us were not privileged to receive these gifts of early attachment that lie at the root of a strong sense of self, of resilience in the face of turmoil. Often, these people are, for some time of their lives, lost and empty souls, trying to recover the tattered shreds of early psychological development gone awry. It is a difficult life marked frequently by darkness and self loathing. For who can love themselves if they have never felt loved? As we try to aid these individuals, we can be met by an odd resistance that as helpers we find confusing. We believe wholeheartedly that there is a path to redemption, and we offer that with the utmost sincere intent. But if we are to truly be of value to these individuals, we must first do what seems almost impossible for our hearts, to simply bear witness to their pain without attempting to change it or even provide a little solace. These are souls who fight endlessly with their dark inner forces, but never see the possibility of release. Although in the long run change and healing may occur, we as helpers are first called to simply witness the battle throughout a seemingly long and endless night. Why are we called to engage in this paradoxical behavior? To sit with and not actively help one who is in pain. To say that the human psyche is complex is an understatement, and for anyone to pretend that they have a definitive answer to this question would be folly. But the following framework offers an understanding of how these wounded souls may need us to guide them. We must accept, until that person is ready to change, an identity rooted not in hope, but in despair. We must accept, as one patient described it, thoughts that are 90% negative. Perhaps only then might despair give way to hope and the possibility of redemption. Now, this does not mean that we abandon hope, but rather that we understand that the possibility of getting better, of moving beyond a wounded self, might be seen as a negation of, an abandonment of, all that the person has experienced. We must first validate a self that received insufficient succor, a self that does not understand the light at the end of the tunnel, but only an endless darkness. If I tell you, for example, to use medication to get rid of overwhelming symptoms, I may be inadvertently invalidating the only self you have ever known, as painful and as dark as that might be. To ask ourselves to support someone who is experiencing life this way can at times feel unbearable. Parents struggle to accept that their children can be in this much pain. Treatment providers rush to offer solutions to symptoms and problems. Friends flee because of the demands placed by these individuals on their most intimate relationships. And if we find the experience intolerable, we can only begin to imagine what the individual experiences inside. But just as our parents held us through moments of seemingly interminable pain, so we must hold these people, indeed all people, with patience and compassion. We must witness their journeys unfolding as their souls see fit, not as we would like in order to quell our own anxiety. Perhaps in the final analysis, as we struggle to ease the emotional and spiritual burden of COVID, it is precisely this that will most powerfully demonstrate our enduring shared humanity. That is, our willingness to lovingly embrace each and every soul that we encounter as God challenges them in their own unique way to wrestle with angels. Thank you.